Well, thank you so much for raising this topic. And you're right. It's not only a serious topic, it's a pervasive topic, and one that we need to understand and address much more fully than we have historically. The facts are quite shocking. Myeloma is twice as common in the African American community than it is in the Caucasian community. And yet, despite these great advances we've seen in myeloma, with doubling, almost tripling of average survival in the last decade, we have not seen that same impact in the African American community. African Americans in the US at least comprise about 20% of all myeloma patients, yet only 5 to 6% that are on clinical trials. They're less likely to obtain a triplet therapy, which we know is critical for good therapy, and they're less likely to obtain an autologous stem cell transplant. So we know that the facts are disturbing. There are encouraging facts, however, that we know based on VA studies and others, when African Americans and Caucasians are treated in the same way, that African American patients with myeloma can do as well, if not better. So the potential is there within the biology to treat patients more fully. So at the International Myeloma Foundation, we've taken this very seriously. We've created a whole African American initiative. We've always been very sensitive to diversity and how many, as you mentioned, have been punished by myeloma. Individuals in more rural areas, individuals without insurance, the Hispanic population, the African American population, all of these need to be addressed. But specifically now, we're embarking on an African American initiative where the key themes of this are engagement of the African American community, having them have a greater trust in the medical community, having them to understand the magnitude of this disease. It is the most common hematologic malignancy within this population. So that they're not being told, but they are engaged in the whole process of understanding and caring for myeloma. Number two, education. We are launching a large initiative to educate primary care physicians about early and accurate diagnosis of myeloma in the African American population. One of the disturbing facts is that the average African American patient is not only diagnosed at a younger age, but has a longer lag between their start of symptoms and diagnosis. So catching the disease earlier is important. And then thirdly, understanding the disease better in this population becomes very important as we study it and as we work together to really have an impact on the medical oncology and hematology community at large, to recognize this disparity and within their own individual clinic and also in the community at large, that we overcome that disparity, appreciating the nature of the healthcare team and how important it is that we provide African American patients with the best care possible.